So my name is Natalie Beveridge and I'm an acute medicine physician at Whiston Hospital in Mersey and West Lancashire Hospitals Trust, and we look to reduce the length of stay of patients with respiratory tract infections and trying to reduce the use of IV antibiotics and removing oxygen. So we know that the NHS contributes to around 4% of England's carbon emissions, and within that, acute care has the largest contribution. So we hope that by reducing length of stay of patients in our hospital and reducing the use of intravenous antibiotics and removing oxygen as quickly as we safely can, that we are helping to reduce unnecessary pharmaceutical use and medical gas use. So our department worked with the Society of Acute Medicine, where we were supported by some quality improvement experts to run a 12-month improvement project using model of improvement PDSA cycles and having weekly meetings and reviewing where we were with our patient cohort. We had a multidisciplinary team, so tried to involve key stakeholders, and the team grew really as the project went along. So what we found was that at baseline, 30% of the antibiotics that were being given in our department were intravenous, and that was unnecessary. So we worked to reduce that over the period of the 12 months, and we found a sustained 16% improvement or reduction of unnecessary IV antibiotic use. And when we extrapolate that up across the department's annual activity in respiratory tract infections, we have projected that we would save 2,500 kilograms of CO2, and that is just the plasticware associated with the drugs, because we don't have access to the information about the drugs themselves, and over £2,000 a year. One of the most striking points about it, though, was that each drug takes 20 minutes to make. So we also projected that we would save 80 nursing shifts over the year, and it facilitates patients getting home, which is much better for them from an experience perspective and a patient safety perspective. Also means that we can remove the intravenous access device, which has a whole load of other risks associated with it being in situ. So the other large part of the project was trying to reduce oxygen from patients as soon as it was safe to do so, and trying to be proactive in that. So we went through different approaches to this. We started off with the team doing it, and then the nurse that was looking after the patient themselves. And what we found was that 50% of patients that were weaned managed to get home the same day. And if we use very conservative estimates, so if we say that every day we can wean 2 patients off 2 litres of nasal oxygen, we can extrapolate that up to almost 2,000 kilograms of CO2 equivalent emissions as well. And that's not including the plasticware, that's just from the oxygen medical gas use. So in this climate emergency, I think it's all of our responsibilities to consider sustainability in our everyday clinical practice for the patient that you're seeing in front of you, and to consider how that's going to impact the patients that you'll see tomorrow and then further down the line in the future, and the impact that we're having on our planet. And then I would offer a plea for you to consider sustainability to be built into your improvement projects, because often best or better clinical care or streamlined clinical care often aligns really closely with healthcare sustainability benefits, along with economic benefits and improved patient experience.